What frequencies are used in a bladder ultrasound for deep imaging? Imagine trying to see deep inside your body with a gentle sound wave. That's exactly what ultrasound does, especially when doctors want to look at the bladder's deeper parts. When it comes to imaging the bladder deeply, the key is choosing the right sound wave frequency. For deep imaging, ultrasound machines typically use lower frequencies, around 2 megahertz. These lower frequencies are like a long-distance call. They can reach further into tissues but give a less detailed picture. This is perfect for seeing the back wall of the bladder or structures deep in the pelvis. For example, specialized bladder ultrasound devices often operate at about 2 megahertz to get a clear view of the deep bladder and detect abnormalities even at greater depths. On the other hand, for more detailed images of the bladder and nearby areas, higher frequencies are used, usually between 7 and 10 megahertz. These higher frequencies are like a close-up lens. They provide sharper images of the bladder walls, sediment, or small tumors. Since the bladder is close to the surface and filled with fluid, these higher frequencies work well because fluid helps transmit sound waves with minimal loss. But they don't go as deep as the lower frequencies. The choice of frequency depends on what the doctor needs to see. If they want to examine the deeper parts of the bladder or pelvic structures, they'll opt for the lower end, around 2 megahertz. If they need a detailed look at the bladder wall or detect small abnormalities close to the surface, they'll choose the higher frequencies. The way ultrasound works is that the piezoelectric crystals inside the probe generate sound waves at specific frequencies. Higher frequencies tend to get absorbed or scattered more quickly in tissue, limiting how deep they can go. Lower frequencies can penetrate deeper but with less detail. So, in summary, for deep bladder imaging, ultrasound machines usually use around 2 megahertz to see the posterior bladder wall and deeper tissues. For more superficial, detailed images, they use higher frequencies like 7 to 10 megahertz. This balance helps doctors visualize bladder health, detect tumors, or assess other abnormalities accurately. Always remember, if you're having a bladder ultrasound, your healthcare provider will choose the best frequency based on what they need to see. It's a safe, non-invasive way to get important information about your bladder's condition. If you have concerns or need a detailed diagnosis, be sure to discuss it with your doctor, who can explain what kind of ultrasound is best for your specific situation.